Skin cancer is the most common cancer in the United States. Melanoma is the most dangerous type, and it is less common than other forms of skin cancer. In this article, we will describe the symptoms of the most common types of skin cancer and explain how to check the skin. We will also investigate prevention, causes, and risk factors, as well as diagnosis and treatments. Symptoms and warning signs. Basal cell and squamous cell carcinoma are two examples of non-melanoma skin cancer. The US-based Skin Cancer Foundation says that everyone should examine their whole body, from head to toe, once a month, and take note of any new moles or growths that have grown, moles or growths that have changed significantly in another way, lesions that change, itch, bleed or have not healed. The most common sign of skin cancer is an abnormal pink or brown spot, patch, or mole. There are different forms of skin cancer, and the most common are basal cell carcinoma, squamous cell carcinoma, melanoma. Melanoma is the type most likely to develop in a mole. Enlarged lymph nodes can also signal skin cancer. Lymph nodes are small, bean-sized collections of immune cells beneath the skin. Many are in the neck, groin, and underarms. How to spot basal and squamous cell skin cancers. Basal and squamous cell skin cancers are more common and not as dangerous as melanoma. They can develop anywhere, but they are most likely to form on the face, head, or neck. A basal cell carcinoma may look like a flat, firm, pale or yellow area of skin, similar to a scar. A reddish, raised, sometimes itchy patch of skin. Small, shiny, pearly, pink or red translucent bumps, which can have blue, brown, or black areas. Pink growths that have raised edges and a lower center, and abnormal blood vessels may spread from the growth like the spokes of a wheel. Open sores that may ooze or crust, and either do not heal or heal and return. A squamous cell carcinoma may look like a rough or scaly red patch that may crust or bleed. A raised growth or lump, sometimes with a lower center. Open sores that may ooze or crust, and either do not heal or heal and return. A growth that looks like a wart. Not all skin cancers look alike. The American Cancer Society recommend that a person should contact a doctor if they notice a mark that does not look like others on the body, a sore that does not heal, redness or new swelling outside the border of a mole, itching, pain, or tenderness in a mole, oozing, scaliness, or bleeding in a mole. Causes and risk factors. Researchers do not know why certain cells become cancerous. However, they have identified risk factors for skin cancer. The most important risk factor for melanoma is exposure to ultraviolet (UV) rays. These damage the skin cell's DNA, which controls how the cells grow, divide, and stay alive. Most UV rays come from sunlight, but they also come from tanning beds. What causes non-melanoma skin cancer? Overexposure to ultraviolet (UV) light is the main cause of non-melanoma skin cancer. UV light comes from the sun, as well as from artificial tanning sunbeds and sunlamps. Other risk factors that can increase your chances of developing non-melanoma skin cancer include a previous non-melanoma skin cancer, a family history of skin cancer, pale skin that burns easily, a large number of moles or freckles, taking medicine that suppresses your immune system, a co-existing medical condition that suppresses your immune system. Other risk factors include moles. A person with more than 100 moles is more likely to develop melanoma. Fair skin, light hair, and freckles. The risk of developing melanoma is higher among people with light skin. Those who burn easily have an increased risk. Family history. Around 10% of people with the disease have a family history of it. Personal history. Melanoma is likelier to form in a person who has already had it. People who have had basal or squamous cell cancers also have an increased risk of developing melanoma. Preventing skin cancer. The best way to reduce the risk of skin cancer is to limit exposure to UV rays. A person can do this by using sunscreen, seeking shade, and covering up when outdoors. Anyone wishing to prevent skin cancer should also avoid tanning beds and sunlamps.